Hello you guys, I am Dr. Sheila Farhang, or better known as Dr. Sheila Derm in social media. Welcome to my YouTube channel and welcome to my dermatology practice, one of my exam rooms, Avant Dermatology Aesthetics. Okay, and I thought this would be a great setting to talk about acne scarring, what you can do, different forms to do at home, at a dermatology office. I treat acne scarring all the time. Fun fact, or very important fact, is I make sure to treat the acne first before we delve in and treat the acne scarring, because I feel like it's a waste of money if you're treating the scarring and you're still breaking out. So that's one really important thing. If you see if you want to go get your acne scarring done and the person is not really focusing on the actual acne, you're kind of wasting your money. So that's one really kind of tip that I want to give you to start off. So acne scarring comes in different forms. So first, let's talk about the discoloration, the post-inflammatory hyperpigmentation, which is the reds or the browns acne after an acne spot. The browns, or kind of the reds is kind of from inflammation. The browns that can stick around for like 4 to 6 months, especially in darker skin tones, is an excess in melanin production. And so the first thing that I tell people is that you gotta wear your sunscreen. I know it sounds really cliche and really general, but the sunscreen decreases the melanin hyper proliferation, I guess you could say. And so that really helps the acne not turn, the post-acne mark not turn so brown, so you're not dealing with all these brown spots if your acne is getting better. In fact, it looks worse sometimes if you just have 1 or 2 breakouts because your acne is getting better, but then you have a whole bunch of red and brown spots because you didn't wear sunscreen. Even in African American skin, black skin, gotta wear sunscreen as well. And so that's my first tip. None of these are sponsored, by the way. These are some of the things that I recommend, that I use myself, and that I just have in my office. And so drugstore, for my sunscreens, I just say, whatever sunscreen that you will wear is one that I recommend. I do recommend mineral-based sunscreens over chemical, of course, although in darker skin types, it's really hard to find one that doesn't have an overcast, a white cast. And so sometimes what I do recommend is just putting in a couple drops of like a Dermablend iron oxide foundation into your sunscreen to make it tinted and make it like that color without leaving a white cast. But we've gotten really good at formulating kind of aesthetic formulations that aren't thick, that don't leave a really kind of greasy feel. And so with my sunscreens, I tend to be whatever finish that you like, you can get. This is a very personalized approach. I personally like a matte finish. I'm not really like a glowy type of gal. And so depending on kind of the finish that you like, SPF is just goes through an FDA process. And so in the US, that is. And so the SPF really above 30 to 50 is what I recommend on the face. Anything under like 15, I really don't recommend, because then you have to reapply more. And so one really good kind of affordable physician-dispensed is Ulta MD. Maybe you've heard of this one. A lot of people really like this one. It is kind of a higher price point, but not too high. I think it's around like $20 to $30, maybe $40 at most for the bigger bottles. And so that's a physician brand one. And so if you really can't find one over the counter, this is one that a lot of my patients like, especially men. My husband likes this one. La Roche-Posay, I've talked about this in my Come With Me video. This is a very underrated product, or line in general. I really like their sunscreens. And so that's one that you can find over the counter at drugstores. And this is the Toleraine line, which is more like hydrating, double moisturization, versus this one is more of like that mineral-based sunscreen without all that moisturization. And really that just depends on your skin, if you're on acne products, if you want more moisturization or not. And so first step, sunscreen. Second is basically a pigment inhibitor, or something that decreases the pigment over time, whether that be hydroquinone or non-hydroquinone base. And so I do recommend and I do prescribe hydroquinone to some of my melasma patients. I don't do it so much for acne all the time, but you do need to get on a drug holiday with hydroquinone. You can't use it chronically all the time, as it can cause some permanent damage to the skin, such as something called ochronosis. That's debatable. Some people are just more genetically predisposed to that, and so it's kind of hard to tell. But I think in general, dermatologists and skincare experts, well, at least dermatologists, don't recommend hydroquinone every day, every single day, without just stopping for a few months. So a couple that I do recommend, really depending on if there's melasma there, what type of skin type there is, if someone wants a serum or not. There's, other types of skin topical treatments that can help increase the lightening of those post-acne scars. So even if you didn't do anything, they will fade over time because your skin is regenerating, but it could take like 4 to 6 months. And so these kind of just help increase the sloughing, decrease the pathway of the pigment pathway in your skin right after an acne scar, and lightens them. And so, the even tone corrector, Cispera, and their retinol even, I recommend not only to increase the cell turnover and kind of unplug the pores, but it actually lightens the acne scars as well. So that's stuff that you can do at home. Those are like little tips and tricks that I do for those acne scars that are colored. If someone really wants to go in and do something a little step forward, then I recommend some peels, some medical grade peels. I use PCA, and depending on the skin types, I will use hydroquinone, non-hydroquinone, with resorcinol, without resorcinol, usually if it's a Fitzpatrick. So my Fitzpatrick is about a 3 or 4. So if it's me or maybe higher, or someone has a tan, I don't use resorcinol. It just really increases that sloughing, which sometimes we don't need, because when you get more damage on the face, or if you overdo it with products or exfoliants, you can cause damage and then the pigment can get worse. And so these are some of the peels that I do in my office. I can show you guys a video of that right now. It's good for, again, the discoloration. It's good for actual acne. And so peels are actually one of the things that I do treat acne scarring if a patient does have active acne as well, because it's treating the acne as well, such as a Jesner's peel, which is salicylic acid, lactic acid, and resorcinol. And so that's kind of my exception to the rule, where I'm treating acne scarring and acne at the same time. Same with like some of the topical treatments such as retinol. All right, next up is some of the more aggressive permanent scarring, which is the pitted scars, which is like the little pinpoint scarring. Those are very difficult to treat, or boxcar scars or rolling scars. These, I will say, over time, yes, they can get better, but you need something there to traumatize the skin as far as a procedure, because skincare is not gonna really get rid of it, honey. Trust me, I've had it. I had acne as a teenager and throughout med school, and I'm still doing procedures to help some of the acne scarring that I have. And we're talking about the ones that are, we call them atrophic scars, okay? Thicker scars, maybe in this area, if they've left hypertrophic nodules, which are thick scars, then I will go in and inject them with the steroid to break up the scarring. But right now we're talking about kind of the common scarring that you see that are textural changes, that are divots in the skin. And so for this, I do a very big multimodal approach. If they're kind of just that rolling or boxcar scarring, I will do a resurfacing type of laser. One that I really, really like is fractional radiofrequency with microneedling. This is not just microneedling, I have that, and I'll talk about it, but one really big investment for the skin, and it's a little pricey, but kind of for your best bang for your buck without the downtime of the sloughing of the skin, is this radiofrequency with microneedling. So I go and I stack on the cheeks usually, or wherever the acne is, and I do it stacked mode, and I go in, and you go in 4 millimeters, or I go in 4 millimeters with a very high energy. And what happens is, yes, although you do get some trauma in the area from the microneedles, it's controlled trauma that we do want, because your skin will go in there and repair, and that's how the scar kind of heals up. And so, and then adding the energy in there, you're actually disrupting and then getting collagen regrowth. That's what you need, because you have loss of collagen, loss of skin in that area, on the kind of loss of the epidermis and collagen structures in the inside from the scar kind of pulling down and tethering down. And so I love this one. Usually I recommend a session of 3, 1 month apart, and patients really, really like this. This main thing that I use this for is skin tightening. I just showed you guys a, I think, morning video routine where I just did this. Actually, I just did this like 5 days ago, and I'm loving it. So I do it as a maintenance by like now. All right, so these are kind of some of my other skin tightening devices. Actually, let me know in the comment section below if you guys want me to talk about some of my most popular cosmetic treatments in office. And while you're at it, click that subscribe button and click that notification bell so you don't miss a video. All right, so that was kind of like my bigger one. If, you know, the budget's not there for a fractional energy-based device, then we can do microneedling, which I do a lot. This is just microneedles, and I go in about 2.4 millimeters, and you do need numbing. We do get blood showing, and so this is a kind of a medical procedure. It's kind of like the vampire facial, and so some of those traumas from the microneedles, it's not painful because we numbed you, really kind of help that textural change, similar to this right here, except that goes deeper and that has energy. And what's nice about this is once you have the micro kind of pores or micro channels open from the microneedles, I go in with a peel afterwards, and so it's a very, very great, pretty affordable procedure. Of course, these aren't cheap, but you're not spending thousands and thousands of dollars, you're spending hundreds. All right. And for these, I do recommend a session of, you know, a few sessions. One, you will get improvement, but usually around 3 is whenever you get about 80 to 90% improvement. So other things that I do like to do, so I just did a video on the difference between Botox and filler. If you haven't seen that one, definitely check that one out. So filler here, this is a product, specifically hyaluronic acid, which is a sugar molecule that adds volume. And so I didn't mention this in my last video, but one other thing that I do with filler is that I go in and I use the needle to subcise this tether that's pulling down on your acne scar, very similar to cellulite, and I go in with the needle and I kind of cut that up so then it pops back up. So then you get that dimple pops back up, and then I fill it a little bit with some filler, because sometimes the skin, even though you do trauma, even though you do this, the volume loss is there, and you really have to add a little bit more volume in there to get that really kind of surface that you want, that texture that you do want. And so I do this a lot. You do have to, you know, the filler is not cheap, but you know, the filler is between $500 to $700 a syringe. And so going in, and I usually just throw in the subcision in there, and we go in, and this has great results. I do this on my own acne scarring as well. And so it's all about a multimodal approach, targeting texture, targeting the divots, what type of divots, because everyone has different acne scarring. So for the pit scars that are like literally like a little ice pick scar is what we call them, I do something a little different, because filling them sometimes doesn't work because it's like literally a little like ice pick in there. Sometimes energy-based doesn't work either. So I use a high concentration of a TCA peel, 80%, and I do something called TCA cross, and I'll show you guys a video footage of this. So basically I take a little toothpick or something similar to that, and I put the acid on the toothpick, and I just go down the little hole. And then depending on the strength that I decide to use, if someone does have a darker skin type, then I will use maybe a 35, 40, try that out, and then wash it afterwards. Or sometimes I have them wash the acid the next day. And so I'm always a little bit more conservative in the beginning, because I don't want you to scar from something that we're doing for you to decrease scarring. And so everyone's skin type is different. This is why it's so, so important to go to someone who has lots of experience with acne scarring. Also, I know derma rollers and all those things have become really popular, and they say, oh, acne scarring. So for me, at-home derma rollers don't even really break the skin. If they do, that's not good, because over time they're dulling, and you're actually traumatizing your skin by that pulling. It's basically tearing your skin. And although some of them that are very, very, very superficial, I do like those kind of to increase blood flow to use so your skincare can get absorbed in really well. those aren't really for acne scarring, especially the deep ones that you and I are kind of talking about here. And so it's really kind of just don't waste your time, don't waste your money, see a dermatologist and really just get it done, because we can definitely help you. I know I've seen so many patients that went on Accutane or isotretinoin and their acne got cleared, but they're dealt with these permanent scars, and you don't have to live with that. You do not have to live with that. And so these are kind of my little multimodal approach for acne scarring. Of course, there's CO2 or ablative lasers that kind of ablate the whole skin. That's a little bit more aggressive. Although I do have training in that, I don't personally do that in my office. I think that the modality that I have here has lower downtime, is a little less risky, and doesn't really disrupt the top layer of the skin. And so at the moment, these are really great for that. So hopefully that really helped you understand really what types of acne scarring there is out there and what you can do about it. So hopefully that was helpful, and see you guys later.